Pre-procedural preparation of the nasal cavity was performed using naphthalene nitrate and 5 ml of 2% lidocaine jelly. A nurse and a clinical engineer assisted with the examination and provided supervision. 10 minutes after the start of preparation, EZD was begun. The endoscope is inserted into the esophagus in time with deep swallowing. The endoscope was advanced into the stomach while observing the esophagus. Upon reaching the stomach, the greater curvature of the upper gastric body was visible from the front. At this point, the left arm was rotated counterclockwise to apply leftward torque to the endoscope. The endoscope continues advancing to the antrum and then passes through the pylorus. The endoscope is gently pushed while the tip is deflected upward, and the left arm is rotated clockwise to enter the second portion of the duodenum. After observing the second portion of the duodenum, the endoscope is redirected into the stomach. The entire gastric mucosa was observed using a standard technique, including the retrofraction maneuver. In our experience, proficiency in this technique was achieved after 2 to 3 self-performed EZD procedures, allowing for stable examination. Gastrointestinal fellows must have mastered the basic EZD techniques before self-performed EZD. It would be preferable to attempt self-performed EZD after gaining experience with approximately 100 cases of conventional EZD. Monitoring during the examination is essential. Medical staff members should supervise the procedure. We have attempted EZD in the seated position before. However, compared to the standing position, the range of motion of the left arm and upper body movement was restricted, making the procedure significantly more difficult. Therefore, we do not recommend the seated position and regard the standing position as optimal for self-performed EZD. Finally, the esophagus and pharynx were evaluated using blue laser imaging during endoscope withdrawal. This procedure may enable endoscopists to gain deeper insight into the patient experience during EZD, refine their endoscopic skills, and monitor their own gastrointestinal health.